I'm Chaka Suzuki with Real Self TV, and we are down in San Diego with America's top dermatologists, including Dr. Jeremy Brauer. Welcome.
Thanks for having me.
Today we are going to talk about VBeam, but before that we do that, can you tell us what your specialty is and where you practice?
Sure. So I practice in Manhattan in New York at the Laser and Skin Surgery Center of New York, and I am a Mohs surgeon, but also do laser surgery and cosmetic surgery.
All right, let's talk about VBeam. What is it, and what does the device look like? What can I expect when I come into your office to get treated?
VBeam is a highly utilized laser in our practice. It is a pulse dye laser, meaning that it specifically targets what we call vascular lesions or conditions, so anything that's related to blood vessels.
And how do these blood vessel problems come about? Sun damage?
So it could be sun damage, scarring. There are medical conditions that there's overgrowth or proliferation of blood vessels, such as a port wine stain, hemangiomas. You can have broken blood vessels, also known as telangiectasias, that appear in highly vascularized areas like the middle of the face. So a lot of people will have broken blood vessels on their cheeks, their nose, on their chin. Conditions such as rosacea, where there's a background of redness or erythema that's going to be involved as well.
And you mentioned port wine stains, which I think usually gets treated early on in life. Is there a certain age where you should be over to be treated by VBeam, or is it any age?
We firmly believe the earlier the better. So early intervention is right after birth. If it's evident, we'll treat it.
Oh wow, and it's safe to use lasers right after birth?
It is, yes.
And are there any risks associated with the VBeam that our viewers should be aware of when considering this treatment?
So there are always risks with lasers. You have to make sure that you select the appropriate physician to perform the treatment, who hopefully will know if you're an appropriate candidate, if your condition is appropriate, what the parameters or settings that should be used, how often treatment should be performed. So as long as you are confident in your practitioner and they're confident in their ability, you should be good. But there is always a risk of scarring, change of pigmentation with lasers.
And what does it feel like when you're using the VBeam? Is it painful? Do you use topical anesthetic?
So we do use topical anesthetic many times. If not, what you can expect to feel is a rubber band snap, and prior to that, it's a cold spray. Prior to the rubber band snap sensation. And
after the treatment, is there anything about aftercare that our viewers should know about? Any creams or icing or?
So depending on what condition we're treating and how aggressive we are treating you can be left with pretty significant bruising. So to minimize, or I should say to expedite the clearance of that, we actually have started to use the VBeam 2 days after initial treatment. In some cases, some are using it even sooner to expedite the clearance of that bruising. Otherwise, good sun protection. You can use ice to minimize some of the swelling.
Okay, great. Well, thank you. That was so much great information, Dr. Brauer. And if you'd like to learn more about him, you can check him out on his profile on realself.com. Thanks so much. We'll see you again soon.